Hi, everybody. On behalf of the Alliance of Community Health Workers, Navigators, and Promotores and the Patient Navigator Training Collaborative, we're really excited to continue on with our series related to mental and behavioral health and thinking about specific interventions and approaches for our community health workers and navigators and care coordinators and folks who are doing the work in the field in the community. We've had a great series so far with a lot of great background and resources from our state health department partners, Colorado Behavioral Health Council, as well as those who are private and independent experts in the area. So we're really excited about continuing this work as the next two sessions and series really dig into interventions and approaches that navigators, CHWs, can really integrate into their work, and some examples of different programs who have engaged CHWs and PNs. So we're excited to have Nick Flattery and Kristin Kilbourn joining us today, and we'll share a little bit about Nick and Kristin. For those of you who weren't able to join the first sessions that launched in early May, every Wednesday, they are saved onto the PNTC website. So check those out. If you want to rewatch or the like, let us know. And we do plan to continue on with those folks who are from the agencies who provided great resources in detail. PNTC and the Alliance will continue to provide the resources and connections. And I just want to say from our last training, our last session, we had some really great feedback about what additional trainings are available in terms of working with mental health and also behavioral and substance abuse. So we're going to keep in touch with these partners to provide more training in this area that's adequate and appropriate for CHWs and PNs. So a huge thanks to all of the folks who've been engaged in this series. And we'll move on with our presenters today. So I'm very excited to actually introduce two folks that are two of my favorite people to work with in the cancer world, as well as in the our work in the Alliance. Before we get started, we'll have Erin share a little bit about our Zoom work, and then I'll introduce Nick and Kristin a bit more formally, and we'll delve into today. So Erin, what do we have for technology needs, and what do folks need to know?
Sure. Hi, everyone. I just want to point out a few things for you today. In the lower left-hand corner, there's an audio option. If you need to increase the volume or play around with any of your audio settings, you'll find it there. Also, towards the middle of that toolbar, there's a Q&A. That's where we'll have you enter your questions, and then we will have our speakers answer them accordingly. So Andy will keep an eye on that to make sure that we answer all your questions. And that's all I have.
Okay, great. So Nick is going to be our first presenter, and I've already shared with Nick and Kristin. You all can read their bios and information about them. I'm going to actually take some liberty, because I know them personally, just to share a little bit about who they are, background, and why we invited them in today. So Nick is on our steering committee and our current president of the Alliance. So we're excited for all of the great passion around community health work and engagement. I think that Nick has been someone who's very committed to our Colorado communities, and I think that when their last grant cycle, that they were really thinking about cardiac and really thinking about the community health work and behavior of cardiac prevention and different types of initiatives to really explore mental and behavioral health and really thinking about whole person care, I thought was quite commendable. And I think they've had a great grant, which Nick will talk about their work with CPC and the great work that they're rolling out. But I'm very impressed with a lot of the work that him, Stephanie, Maury Krantz, and many of their colleagues have really put into play. And I do think that without Nick and several of our folks from the steering committee, we wouldn't be where we are with the funding and with the initiatives for the Alliance. After Nick, we'll have Dr. Kristin Kilbourn, who will also present around different health initiatives to think around the behavioral health component and really engage CHWs in thinking around this work, and how do we think about inpatient engagement related to mental and behavioral health. And I've had the courtesy and the great fortune to work with Dr. Kilbourn for actually the last decade related to a number of initiatives related to health, cancer prevention, and would say as a health psychologist, I think she's got a number of great tools and resources to bring to our community. So thanks a ton for Kristin for joining us today as well. So I'm going to turn it over to Nick to bring up his slides and to jump into today. And I think this session, as well as next week, we're really trying to think further about building on what can CHWs and PNs really put in their toolbox to think about guiding their work moving ahead. We've had a lot of great resources and background, but we're really excited to have Kristin and Nick with us. So Nick, I'll punt to you.
Okay, so hi everybody. Thank you, Andy, for, anybody see those, that right there? Okay, great.
Looks good.
So thank you, Andy, for the introduction. Again, I always say when I'm in an Alliance meeting, if it were not for Andy Dwyer, the Alliance would not be here. So big kudos to Andy, and it is an honor for me to work on the Alliance. My day job, quote unquote, full-time job is working for CPC Community Health. In CPC Community Health, we've done a lot of community programming around heart disease specifically, but more around chronic disease for almost 15 years now. We love the work in the community. And again, we've mainly done just chronic disease stuff. So again, I want to do a shout out to my team at CPC as well. Ashley Ambrose is a program manager there, does excellent work with our day-to-day needs with the program. Stephanie Cornell-Mokler, who's been around since the inception. She's just a huge advocate for this work and just wonderful to work with. And then Dr. Maury Krantz and Dr. Ray Estacio, who are also on our team. And finally, Dr. Sam Hubley, who's no longer with us, but he was our mental and behavioral health consultant that worked with us on our program to really get our program up to speed to where we wanted it to address some of the mental health disparities in the communities that we're in. And finally, I noticed on the participant that we have a couple of our health navigators. So welcome, Michelle, and welcome, Sally. I'm excited to talk about your guys' excellent work with our program. So, all right, so where are we? Our program, again, is funded through the CCPD grants program, so the tobacco tax. And so we actually are a statewide program. So we have, it's ebbed and flowed. In fact, we don't have our Montezuma site this year, but all other areas we're kind of around the state. So up in the Northwest, up in the Northeast, thank you, Michelle. Down in Kit Carson, thank you, Sally. And so we're across the state. So what was our model? So for about 10 years, our model really focused again on that health coaching screening piece of it. And really we just did focused on those health behaviors. So we did health screenings. So we did cholesterol, we did blood pressure, we did BMI. Cardiovascular disease risk score that we'd give people. And then based on those risk factors, we'd counsel on them. And either they'd be referred out to community-based program, something to address their social determinants of health, to their medical provider, and our other social services needs. And then we'd bring them back, retest them. And once we retested them, I think we found that that health coaching by our navigators, community health workers, just did an incredible job with those individuals. So we continued that in this grant cycle. So in 2018, we were, again, won a competitive grant with the CCPD grants program. The only thing we added really was this mental behavioral health component. So we felt we had a strong workflow already, but we wanted to add some various behavioral and mental health tools. So we actually did a little brief survey of our communities and asked if they felt that mental and behavioral health was a need in their community. And overwhelmingly, it was. In fact, we went to, there's a needs assessment that a lot of the counties do at the local public health department level, and almost exclusively in all of our counties and communities, mental health was a need. And so while we didn't want to, I want to make this clear that we don't ask our health coaches, our health navigators, our community health workers to counsel in any way, shape, or form. And I'll kind of explain what we have added that is something that really addresses health behaviors more than anything. So this is another visual of our model. Again, we still do our screenings. As part of the screenings, we do mental and behavioral health screening. And then we're able to refer out. So we've actually, I know Michelle, actually up in Northeast Colorado Health Department there, has been referring to one of our telehealth partners. So that has been heart-centered counseling is what they're called. And so they are a statewide resource for anybody that maybe may not want to see a mental health provider in their community. If it's too small of a community, they want to do telehealth, telecounseling kind of stuff, they offer those services. I mean, if anybody wants those services, I can definitely email those to you later on. But again, we have these outside things outside of our program that are kind of ancillary. So we train our own individuals. Again, that's why we brought on Dr. Sam Hubley to address those mental and behavioral health pieces. We have a data repository, data collection system, and decision support system that we've created called Oscar. And public health detailing. So Dr. Krantz does send those out to engage a lot of the medical providers in our community. So what are those tools that we added to CHHS? Colorado Heart Healthy Solutions is our program. We call it CHHS, which I affectionately call CHEES, which is, you know, a pro and a con if you're in a heart disease prevention program. So the underpinning that we have always had in our program has been motivational interviewing. Motivational interviewing has been, you know, the basis for which we built everything else to address those mental and behavioral health needs. So our health navigators always have had motivational interviewing. They've gone to multiple trainings. And so motivational interviewing is key, I think, to addressing mental and behavioral health stuff. And then after that, the next three there are these behavioral or mental health screening tools that we have added. So they're evidence-based, they're used in clinical settings. And so we added that to our Oscar system. And based on the different scores, it'll either populate to, you know, a PHQ-4 or PHQ-8, a GAD, you know, those initial GAD questions or the full GAD analysis. So those are just three things. And then for you know, a mental health overview training, what we did was we asked all of our health navigators to attend a mental health first aid class. Now, with the pandemic going on, I think they have canceled many of those classes. I'm not sure if there's online resources for that, but again, I would check. If you just type in mental health first aid Colorado, you can check for that. But we sent all of our health navigators. It basically gives you, you know, if somebody is in a crisis, what to look for, how to respond to those individuals. And it was a very good thing. And I think it made us feel comfortable sending our health navigators in, because again, you know, our health navigators are spread across the state, and we want to make sure they at least have the tools in case they come into somebody in a mental health crisis, what to do with them. And again, it's all lay people. I took the class myself. I learned a lot for coming upon somebody. And the final thing we added was this behavioral activation case mapping. Dr. Hubley came in, you know, before we applied for the grant, and basically took us through a case map. So he took one of us, you know, had trouble exercising, so he mapped that out for us, and we just had our aha moment that this was something we really wanted to add to the program. It was just another tool to visualize those poor health behaviors, what triggers them, how we're feeling that makes us do them. And so it was just an excellent tool, and I'm gonna really go into depth with that. Okay, so I won't take you too much into this, but cognitive behavioral therapy, there's a couple different strategies there, as you kind of see. So in a full therapy session, so if you're going to psychotherapy and somebody might take you through this cognitive behavioral therapy, they've done some studies. Dr. Sona Jamiji, I apologize, I'm just butchering her name, works with Dr. Sam Hubley. And so she actually has implemented this in some postpartum depression individuals. So some promotoras, some lay health navigators that are really working with those postpartum individuals, and they do some of this behavioral activation case mapping. So she has done this before, and that's why Dr. Hubley kind of brought it to us and says it might be an option. We thought it was cool. So there's all those pieces, and again, if you separate that out, behavioral activation can be its own piece. And in fact, they've done studies, and I didn't list the studies. If you guys want me to send you slides for those, I'd be happy to. But in those studies, they actually found that behavioral activation had a significant impact if they just did that part of the section with an individual. So what is a behavioral activation case map? So again, as I mentioned, it identifies somebody's behavior. So you really start on the other side of things. So you start with the behavior. So our health navigators would be asking, you know, well, I smoke. Okay, well, why do you smoke? Well, you know, I have feelings of stress, or, you know, everything like that. So if you're stressed, okay, what are those triggers for the stress? So really, I'll kind of show you how that works, but you really start with the behavior of that unhealthy behavior and work backwards with that individual. So again, so one of the examples we've done is, what do you do? So an example was, you go to a convenience store and you're thirsty, and what do? Do you get a tea? Do you get a water? No, I want a big gulp. For what, 10 extra cents, you can get 50 more ounces of soda or Coke or whatever people call it. And why do you do that? Well, at work today, I had an argument with a coworker, and that just made me feel like anxious and kind of angry. And I just feel like I needed something to reward myself or whatever. So then you work backwards. That's the first thing. So again, this is the cycles. So there's two cycles that they kind of focus on in this behavioral activation case mapping: the short term and then the long term. So in the short term, the big gulp helps me, reduce stress, or kind of rewards myself because I felt angry because I had an argument at work. Okay, so then once they identify that, they empathize with that person. They use that motivational imagery. I can see that, if I had an argument or something, I would just want some comfort food, some comfort drink, whatever it may be. That would make me feel better in the short term. But let's talk about the long term. What do you think that does for the long term? Does that get rid of that stress or get rid of that argument at work? And look at the vicious cycle that happens. You're going to get in another argument at work, perhaps, or you're going to have another trigger. It's going to make you angry again, stressed again. And then what are you going to do? You're going to go back to that big gulp, and then you're going to gain weight. You're, might be at risk for diabetes, what have you. Another thing is, isolation. So, I feel isolated. Well, why do you feel isolated? Well, I feel overweight and I don't feel like I can go out. I'm embarrassed by that. And identifying that, how you feel about that, is kind of one of those things that people can start to see. Okay, I feel embarrassed because of my weight. I isolate because I'm embarrassed. That's a vicious cycle. And then they can talk about how to break that at some point. So that is really the basis of this. I myself, this is a difficult task, and I'll kind of talk about this later. And Michelle and Sally can attribute this to, because they do it every day, this behavioral activation case mapping. It's a tough thing to learn. It's a tough thing to talk about this naturally, easily with the participant. And so it's just, it may seem, somewhat easy at times, but it's not an easy thing to kind of go through these cycles and know how to do it. And because it wasn't easy, what we did was we kind of came up with some, these are called archetypes. So basically overarching stories, or kind of stories that could be anybody. It could be me, it could be you, it could be your grandma, it could be your mom, your dad, brother, sister. And we thought of these different things. So the basic things that we talk about with people, I ask our navigators or community health talk about, is healthy eating, active living, medication adherence, smoking. So those types of things that really impact your chronic disease risk in the long term. And so we kind of made up these stories. So what you're looking at now is something what we called a roadmap for change. So we created these, sent these out to our health navigators as hopefully an easy thing to hand to somebody, talk about this. So this is Wendy. So Wendy finds it difficult to eat healthy because she's so busy. She's so busy in her life. And so she's eating too much food, fast food. She identified that as a behavior that she wants to address with her health navigator. Okay, well, let's map that out. So why do you do that? What is happening? Why are you eating too much? Well, I just feel overwhelmed. I just, I don't feel confidence in my cooking skills, and I'm stressed about that, and I just go to fast food. I just default that. Okay, well, let's explore why you're feeling overwhelmed. Let's look at why you lack the confidence, things like that. So again, working 2 jobs, limited valuable free time. This sounds like anybody, any number of people, I think we can identify with this. So then it really talks about this. So in the short term, she feels better eating fast food because it's quick, it's easy, it fills her up, it's easy to do. In the long term, she continues to feel overwhelmed because she's super busy and she needs to pay her bills. In the longer term, Wendy could develop health problems from eating poor health habits. She's going to be even more strapped for cash because she might have to start eating having meds and things like that. So then, you identify, how does your story differ from Wendy's, but what is similar to it? And so then we put in some ideas. So what are some different ideas to break that cycle? We got to break that vicious cycle at some point. So again, we just made a lot of different recommendations. And with the participant, you send these things home, you bring them back, talk about it on a follow-up call with those individuals so they can really digest, no pun intended, so they can really digest these different ideas and maps. Same thing, we made one for exercise. This guy, Michael, police officer, low motivation. He likes watching TV instead. It's just easier to do. So let's explore that. Let's talk about the longer term. If you continue not to exercise, what might happen? So it's really identifying what might happen in the long term, putting those people in their future selves to be able to do that. Opportunities and challenges. So I really wanted to talk about this. So some opportunities. What we found is, what Dr. Sona and Dr. Hubley had found is that health navigators, community health workers, they can do this stuff. Most definitely that you guys can do this because you guys have strong relationships. You oftentimes have a lot of motivational interviewing. You're already mapping out unhealthy behaviors. Really, you're already talking about unhealthy behaviors with people. And I think, this really bridges that gap between anxiety, depression, those feelings that you're feeling that then lead to those unhealthy behaviors that then lead to chronic conditions. What are some challenges of this work, the VA case mapping and the other stuff, the other mental health tools that we implemented? It takes time. This stuff takes time to learn and be effective. I would say we started in 2018. We had our training on this in that October. It probably took a full year and change for our navigators to really, really feel comfortable with this behavioral activation case mapping. And then one day it just clicked. A lot of them. And I know some of them, still have a hard time. But again, just recently I saw one of Sally's, case maps, and I just thought it was wonderful. We all thought it was wonderful. We highlighted it on one of our recent calls. She just did a great job of talking with that person and kind of mapping out a certain feeling with them. So kudos to Sally. Kudos to Michelle, too. I've seen great ones from her. But again, ongoing support is challenging but important. So, we really try to reach out to our health navigators, but it's tough. It's tough. We ask them to do a lot. And so this is just one sliver. We want this to be something that they use and utilize. And certainly I think this is a challenge when we have a lot of remote navigators around to be able to keep up with this level. And many of you who do motivational interviewing as well know that as well. If you don't do motivational interviewing for a while, it's tough to keep up with skills as well. It's like anything. And funding, I think, is definitely a challenge. So we believe we can try to continue to show efficacy of the work that we do, the results of what we do. And so, but funding is always a challenge, especially in this time with the pandemic, with the budget shortfalls all around the country, in our states, in our counties. It's definitely a challenge. So that is my presentation.
Awesome. Thanks, Nick. So just as a reminder, if you have questions, please go ahead and bring those up in the chat. But Nick, I guess one of my questions, and you talk about the opportunities and the challenges, you guys basically had the Heart Healthy, the program that you ran out. You actually did a lot of this work and then really integrated the behavioral health components in probably in a more deliberate way in the last 3 to 5 years. Is that correct?
Absolutely, yeah.
So 2 questions for you. What advice would you give folks who might be looking at integrating this type of approach to probably get further into the overall health intervention, really work, and then probably, hopefully, as you're saying, talking about more adherence to the work in general for the behaviors that are related to cardiac and looking at heart healthy solutions. But second question to that, so in addition to like what advice would you give folks who are thinking about this, did you see an overall sort of difference in your evaluation metrics around how patients uptook the intervention and what your primary goals are for the program? Did this, adding this sort of more integrated behavioral health intervention change what you're seeing in terms of outcomes for the overall program? Those are kind of two questions embedded.
Right. So, Andy, you know, this is year 2 of our grant. And so I would say it's tough. We don't quite know yet. And with COVID kind of in place, that kind of put a halt on a lot of our retests going into place. And so our evaluation for specifically, you know, cholesterol, blood pressure, diabetes type measures, we just don't know yet. And so we are going to start looking at those and start correlating them with that mental and behavioral health that we implemented. One thing I will tell you is in the beginning, I think some of the navigators, this was a tough thing to talk about. So some of those questions with those screening tools that we put in place, the GAD and PHQ, they're tough questions. You know, they ask about people's anxiety. You know, have you felt depressed in the past couple of weeks? And so for some of the navigators at first, it was tough to talk with people. And I think some of the participants were taken aback too. But what I will tell you, as time went on, our navigators got more comfortable with it. And likewise, the participants did. And so I think if anybody's scared about, you know, implementing those and even asking about those, we need to start breaking down that stigma. It's a tough thing, don't get me wrong, especially in our rural communities. I think there is definitely a stigma, but mental health is whole person health. And so this is what we've learned. And I think we saw definitely an uptick in the completion of those PHQs and GADs. And that's promising to me. And I'll take that as a win, most definitely. The next iteration, of course, as you know, Andy is alluding to, definitely is kind of looking at those to see if it does make a difference. If we are able to address those that anxiety and perhaps the depression in individuals, will that help their ultimate chronic disease risk factors? We would like to think yes, but I mean, we'll see. We see years down the road if we are ever to retest those individuals again. But as far as implementing that, I would definitely recommend it. You know, I think the more people that are out there doing this type of work, I think the stigma will just break down. And that's part of, you know, the 10,000 foot level. That's what we're hoping to do.
Wonderful. Well, this is an excellent presentation, and love the build, because mental health first aid with Lucille Johnson was last week, and she shared the MHFA approach and was talking a little bit about the opportunity for online training, which you alluded to, Nick, coming, and then really those resources. And we had Sarah Brummett, who was on, who talked about even some opportunities for scholarships on occasion for folks for funding. So we'll try to provide more links. And I know that, of course, Erin and the PMTC have done a great job of providing mental health first aid through the Navigator Training Collaborative. So this is great work. I've had a lot of admiration for the work that you guys have done and resources and tools, and really a great initiative. And I would just encourage Sally, Michelle, and Ashley and others who are on today, if you have any other comments or thoughts or information you want to share in the chat based on being great colleagues and coworkers and colleagues and partners of Nick's, go ahead and do that. Please, we'd love to hear from you, or any other resources that you think might be helpful. So great work. And then just a gentle plug for Nick's program and my program. This Friday, the fate, or the discussion of the beginning of our fate of our CCPD programs in light of the funding issues in the state, there will be some discussion around what's going on related to the different types of community health work navigation programs, as well as chronic disease programs at large. So many of you have probably gotten the announcements that there's a few things that are really vulnerable right now. So if you would like to know more about that, we can share through PMTC information about how to be involved as an advocate or someone in the Colorado community to learn about what's going on with funding for programs like Nick, as well as programs that many of us on the phone are really involved in right now. So I think it's a critical time to help advocate, educate. I guess I'm not supposed to advocate, but we can educate. So we can share more information. Before I punt to Kristin, Nick.
Can I echo that real quick, Andy? Thank you for bringing that up. You know, it's we've just found that our navigators are more essential than ever right now. You know, Ashley and I and Stephanie really have worked to adapt, since we're not doing in-person screenings, to really assist people at home, and how do we do that with that mental health? Again, I think that adding mental health has been crucial to our roles, definitely in the current COVID, and we've added a lot of different workarounds and workflow changes and things like that to support people during this pandemic. But likewise, your patient navigators, I think, with the cancer program, I mean, more essential than ever. So.
Yes, that is definitely it. And I got to tell you, my camera must be telling me to do my hair because it keeps shutting me off. So apologies that I look like I'm doing that. But yeah, there's some definite glitches right there. So I thank you, Nick. I completely agree. And I think in the coming weeks, we'll be sharing also some more work about contact tracing, resource engagement, case investigation, and maybe the potential roles for CHWs and navigators moving ahead with some of our work through the Alliance and other teams. So be on the lookout, but I agree. The approaches that we have and the infrastructure for CHWs and PNs to be responsive during this acute phase of COVID, which we think and what we hear is it's coming back again, maybe with a vengeance this fall. So we have to be primed and ready to go, and we're doing our best to help all the folks maintain funding and resources, as well as think about how to really think about helping serve in the upcoming roles that are being identified, and hopefully funding mechanisms that way. So a lot of interesting things, not all good, but an interesting time, and we'll all try to help support each other through this. So thanks a ton, Nick. Dr. Kilbourn, Kristin, are you ready to go? I'll have you come off mute. I think you're bringing up your slides. Great.
Okay, how's that?
It is good. I think, Kristin, we can see the slides on the left. So if you want to do presenter, but we can see them. So yeah, beautiful. So Kristin, we will go ahead and let you move forward as we continue this discussion about interventions in the field and how to really think about behavioral health. So I'll kick it over to you.
Great. Well, thank you for having me today. And it's so perfect for me to follow Nick because I am going to just re-emphasize the idea that something that he said, which was navigators and community health workers can do these types of interventions. And I love the fact that they're having their navigators and community health workers involved in doing behavioral activation and some CBT work and motivational interviewing. And so I'm going to talk a little more about some of these ideas in a more general sense and thinking about some things that maybe all of you haven't really thought about in your scope of work, or things that you might like to do or get more training in. So today I'm just going to talk briefly a little bit about beyond screening, and then the potential role of patient navigators and community health workers in assisting patients and monitoring and maintaining emotional well-being. I'm going to talk a little bit, because it's hard to not talk about our current times and how some of the things that are important to all of us may be impacting us and impacting the folks that we work with. And then I'm going to end with just thinking about there's, I think, a window of opportunity here for all of us that do this work, and talk a little bit about that. So I will just say screening is certainly important, but it's also important to recognize, first, we know that screening can lead to can lead to false positives, especially when we're working with medical patients who may have a lot of somatic symptoms and can lead to some false positives or elevations in some of the subscales for the measures we use. We also know, and I see this quite a bit in some of the research that we do with caregivers in particular, but also there's potential for false negatives. Sometimes we miss people that are actually pretty distressed. And we know from the research that there are certain characteristics and demographics that may predict people who are less likely to be open, or on screening measures may not accurately describe what they're feeling. So certainly we know in general, sometimes older men in general, may downgrade or score themselves lower on things. We know that there's age factors, also different cohorts, as well as people from different socioeconomic groups and cultural differences. So screening is great, but really, ideally, screening in combination with really knowing your patients and having a good sense of how they're doing is important. The other thing about screening, as you all know, I know I'm preaching to the choir on this, is really, if you're going to screen, you got to make sure you have resources or referrals that you can refer people to if they do end up screening high and they need additional intervention. We also know that screening is great, but it doesn't help us to know, do people ever connect with these different resources that are out there? Are they engaged in mental health services? And lastly, it doesn't tell us much about how people are doing in between visits, right? So my question to you is thinking about, are there ways that you can work with your patients to help them not only to assess their own level of distress or their mental well-being, but also how to manage their well-being between visits or between the next time you're going to meet with them or they're going to be coming into the clinic or whatever environment you may work in. So let's just talk about some different ways to help patients maintain emotional well-being, right? So we know, again, that screening measures are very good first for just determining where people are in terms of their emotional well-being, but we can also use them as ways to monitor ongoing levels of distress. And that will allow us to adjust our therapy or types of interventions that we may be using with them. I think it's also really important to review symptoms of depression and anxiety with the people that you work with. Oftentimes, I hear people all the time as a health psychologist who will be surprised after I do, a very brief assessment of their mood and say, it sounds like you might have a little bit of depression. And they may respond to me with, well, I don't feel sad. So I think, there's a lot of ideas of what the symptoms of depression are, but oftentimes people are not aware that you don't necessarily have to feel sad. Some of the emotions you may feel may be anger, maybe irritability. There are a lot of different symptoms of depression. It manifests differently in different people. I'd say the similar thing about anxiety. I also think it's really helpful to encourage our patients to monitor their emotional well-being on either a daily or weekly basis. And it can be as easy as just a 0 to 10 subjective rating, where maybe 10 is the best and 0 is the worst, or doesn't really matter which way how you anchor things, but it's really just for people to start tracking a little bit more about tuning into themselves and how am I feeling today, or how am I feeling this week, and how does that compare to where I've been in terms of my level of distress. You could link it to depression, anxiety, stress, distress. It's really open to how you might present that to someone. I think it's also important to track different types of treatment metrics. So symptoms, how they're responding, how people are doing, adherence, side effects, and things like that. Interestingly, the paper that had some of these ideas that I referenced was, as most publications are, before COVID. And it was great to see that they were really advocating even then of how you could have more of a home-based assessment, a way of connecting either by phone or text, emails, secure websites with patients at home, and really being able to assess how they're doing with different types of measurements. We already talked about this, and as I said, I think it's great that Nick's team is doing this, is acquiring skills in their patient navigators and community health workers, training them and being able to do brief therapy techniques that we talked about, which is so important. As he mentioned, you're the ones that have the relationships with these patients and really know them. And so, I always say in the work that I do in this area is every time you have a contact with a patient, that can be really impactful, right? Sometimes it's really hard to get a hold of our patients if we're trying to get them on the phone. But when we do get them, it's really important that we think about what kind of impact can I have right now? I would say another important piece is providing guidance on when to seek help and support with your patients. And I'm going to talk more about that in my next slide. And then, of course, directing patients to the different types of self-management resources that are available now to complement whatever kind of therapy or intervention they're receiving. So there's a lot of different things right now around managing COVID-specific distress. There's information about that specific to different medical populations. So cancer, heart disease, whatever kind of chronic illness the folks that you work with may experience or be living with. So helping people to become aware of all the different resources that are free and that are available to them, and kind of helping that to tailor that what would be the most appropriate. I think an important thing, a lot of people, as I mentioned, first off, don't always recognize the symptoms of depression and anxiety, especially again when they're dealing with a lot of medical symptoms. And the other second thing is that oftentimes, even if they do recognize that, well, I'm feeling more anxious now, or maybe they're even experiencing panic attacks or some other symptoms, they're not really sure when is the right time to seek help or seek support, seek professional help. So this is something I think that's also really important in the work you do, is helping people recognize, okay, so I'm starting to experience this, or my subjective rating scores have changed, but now what? So I think first I tell people is just when you start to notice that your symptoms are interfering with your daily life, right? So and I think we're going to see a lot of that, as the COVID, things are starting to open up and people are going out more. I think we're going to see a lot of people with sort of these new or worsening anxiety disorders, social anxiety. They're going to have a lot of fear about leaving their home and leaving their communities. So that would be something I'd say, yeah, that's interfering with your daily life, right? If their quality of life has decreased because of the symptoms, so they're not getting the joy out of life that they used to have, they're not enjoying their life in the way that they once used to, they're not doing the things that they used to enjoy, their hobbies, interests, etc. Family and friends are usually very good in terms of starting to pick up and notice when a loved one is really changing or has changed in terms of their mood, or they're less connected, they're less interested in things that they once enjoyed. So sometimes that feedback can be helpful for people to recognize, like, oh, maybe I do need to think about seeking additional support. I talked about that idea of not experiencing joy in their life. That's often one of the things that I ask people about when I'm working with people with a lot of medical comorbidities or a lot of physical symptoms. And I'm trying to pull apart, is this depression, or is this more somatic symptoms that are side effects of their treatment or related to their medical issues? And so it's usually this, what we call anhedonia, this lack of interest or decrease in interest in things that previously they really enjoyed doing, hobbies, interests, and things like that. And it's different from, there's one thing, sometimes someone's going through cancer treatment and they're not able to do some of the things that they used to do right now, but they're still interested in doing that. So that's not anhedonia. What I'm talking about is more, they're just not interested anymore. It doesn't bring them joy. And then, of course, the last one, which of course I'm sure you all know, is if anyone's having any sort of thoughts around life's not worth living, or any type of suicidal ideation or those kinds of thoughts, that's definitely a sign that you need to help them connect with some sort of resources or support to help with that. Now, I said I want to talk a little bit about our current times. And maybe you heard so much about this, you're tired of it. So I apologize, I'm keeping it short. But certainly, it's unprecedented. We don't have anything really in our lifetimes to compare to what we're going through now, which leads to high levels of anxiety because we don't have norms to say, well, we kind of know what's going to happen, or we have an idea. So there's a lot of uncertainty about the future. People are dealing with this loss of control, sense of helplessness, multiple losses. So things like just independence, being able to go wherever you want to go, being able to do the things that you never thought twice about that now you're not able to do, or if you are going to do them, you have to take all kinds of precautions, and may have really changed a lot of your behaviors. Social connections and relationships, of course, have changed. Much harder to connect with folks. We're having to learn to connect in different ways. A lot of research around whether or not that's the same. It's definitely not the same, but what kind of benefits we get from the virtual versus in person. And then, of course, we're seeing, and we're going to be seeing more losses of financial stressors that people are starting to experience. So certainly, and I think this is important to be thinking about in the role that all of you have, certainly we're talking about a lot of potential negative outcomes right now in terms of the impact of the pandemic. So we're seeing already higher rates of anxiety, depression, in terms of crisis center calls and mental health facilities. They're really seeing an uptick, especially that kind of started in April. We are anticipating that we're going to see more PTSD and PTSD symptoms. So certainly people that have a history of trauma are going to be more likely to experience PTSD symptoms related to this experience. We're also looking at our first responders and anticipating, unfortunately, that we're going to see a lot of trauma-related symptoms in that group. And then also, of course, patients. So there's a lot of literature now coming out about we already knew that being in the ICU dramatically increased the risk of PTSD. And so we're starting to see that already. Some of these people that have gotten through the other side of COVID, spent a lot of time in the ICU, maybe on ventilators, are going to have high rates of PTSD and likely a lot of anxiety and depression. I know another thing that we've been talking a lot about that's sort of coming down the pike is an increase in different substance use, whether it be alcohol, marijuana, tobacco. So there's certainly a lot of concern about this, of how it's going to come out on the other side. Sleep problems have been huge. There's been a lot of stuff around that, I think they even have a name for it, like COVID-related sleep disruption or something like that, of not related to the illness specifically. Certainly we know that people, when they have COVID, their sleep is disrupted, but just related to the stress of people ruminating, getting stuck, worrying a lot about it, sleep cycles being changed. So I hear a lot about people really having problems with their sleep right now. We're also seeing some changes in physical activity, health behaviors in general. So while some people are taking this opportunity to improve their health, other people are finding it really hard, especially if they have anxiety about leaving their home. They may not have the ability to be able to exercise in their home. A lot of the folks that we work with at our psychology clinic are young people that have multiple roommates that are kind of struggling with some of their health behaviors. I think we're also talking about, in terms of nutrition and diet, what is it, the COVID-15, whatever it may be, but thinking a lot of people have turned to stress eating, because as a maladaptive way, I should say, of managing their stress and anxiety. And then, of course, there's just the negative impact of that social isolation and the decrease in social support, which we know is really important for emotional health. We also know it's a really important factor in terms of our physical health. So, for example, in the cardiac world, as Nick was talking about, we know that social isolation increases the risk of having a heart attack or MI or some type of coronary event. So just some things to be thinking about. Now, I want to also have you think about for a moment that there could be some potential positive outcomes to all of this, right? So one thing, and Nick touched on this a little bit, and I would agree that the stigma around mental health is a really tough barrier to break through. But, and maybe I'm being overly optimistic, but I do feel like with this pandemic, one thing that I'm seeing in folks is suddenly it seems like it's a little more okay to talk about our distress, our feeling anxious, feeling depressed, feeling down, because suddenly it's everyone. We're talking about, you know, everyone nationally, globally is experiencing these really, really difficult times and multiple stressors and losses. And so my hope is that it's going to help to decrease some of that stigma around mental health. It certainly made people, if they weren't already a believer in how important it is, it certainly made people recognize that. I also think that there has been, and there's been some nice campaigns out there that I've seen, a real push to get people to consider that maybe this is a good time to quit smoking or decrease or change some of your substance use behaviors that you know are not good for you, but especially we know are not good for you when we have a respiratory pandemic that's going around. So there are people, I've heard that, you know, whether it's losing weight, I want to lose weight to decrease some of my comorbidities, my high blood pressure, or get my diabetes better controlled, or pre-diabetes, managing that better. So it seems to be that a lot of people have higher motivation to make some of these changes right now, which is a good thing. There's less distractions right now, right? So you can get past all the worry and anxiety. You know, a lot of people at least aren't having to commute to work, may have more time to finally focus on taking care of themselves. So again, I think this can be a really important time of helping people start to think about that focus of like, what are all those health behaviors or those things that you've thought about changing for a long time, and now perhaps is the time to really be thinking about them, moving them, you know, in that stage of those stages of change that we talk about when we're doing MI with folks. Along these same lines, I think that there's more time for people to just be more mindful, right? We're getting a lot of information about how to stay healthy, how to boost our immune system, what kinds of emotional health types of things that we can be doing for ourselves. And so oftentimes when we're feeling overwhelmed and have a lot of anxiety about not knowing what's coming down the road and what's the future like and those kinds of things, that's when oftentimes we encourage people to sort of like, let's be mindful. Let's try to be in the now. And in the now, how can you start to become more mindful of your health behaviors? So, you know, it could be whatever it may be, like, for example, eating. You know, I've been talking to people a lot who've been really wanting to change their diet, maybe lose some weight, of mindful eating. You know, we have more of that time now to sort of focus on the now and what we're doing and our different behaviors. And then the other thing, and I'm going to talk a little bit more about this, I know that we're all experiencing sort of this reprioritizing, this sort of recognition of what are the things that are really important to us, right? And for some people, it may be a surprise. Maybe, you know, they've been so busy that they sort of forgot about those things that were so important. We've certainly learned to things that we take for granted to be more thankful for those things. And so I think along this area, as people are starting to really look at what's meaningful in their life, what's important, again, this is a way that a window where we can kind of come in, whether it's working on different kinds of things to help promote or improve or manage emotional well-being, or perhaps it's around health behaviors and what's really important and how they may be at that right place now to start working on making some of these changes. This I'm not going to spend too much time on because you've probably already heard a lot about this. But again, I think these are important ideas to be thinking about, both for yourself, but also for your patients and family members, their family members that you're working with. Different kinds of things that they can do to feel, give them a sense of empowerment, that they have things that they can do to manage some of the distress they may be feeling in their current times. This is a great, one thing I want to talk about is this engaging in pleasurable activities. This is a great time, and maybe I'll bet a whole bunch of people that are here today on this Zoom presentation have picked up either new hobbies or old hobbies or projects that have been like put to the side. So this is a great time to start new projects, hobbies, things like that. That's really good for our emotional well-being. And I just had to show you, this is one of my things that I do for my emotional well-being, which is spending time with my horses. And I'm fortunate that it's pretty hard, even when you're riding with a group of people, to be closer than 6 feet. So riding is one of those great activities that you can be pretty sure that you're going to stay a safe distance from someone else who may be riding with you. Just one last thing I want to say about this window of opportunity is I want you to think about, again, and Nick said this also, and so I'll just reemphasize this idea of how we can link mental wellness and health behaviors together. And a really good way to think about this, and this fits in really nicely with those of you who are familiar with motivational interviewing, is really connecting them to values, right? So the whole idea, and this slide on psychological flexibility comes from acceptance and commitment therapy, which is CBT, like newer therapy. Some of you may be familiar with it, but it's this idea of helping people clarify their values, what's really important, and then how can they set goals, or how can they learn to live by these values, right? So I think, again, this is an opportunity as people are really reconsidering or prioritizing what's important in their life, to think about these could be times where they could make big changes in terms of their mental and emotional well-being, as well as changes to their health behaviors. The last thing I want to say, and this has been really interesting for me. So I work with a range of people with different kinds of medical challenges. I work with a lot of cancer survivors. And it was really interesting to me at the beginning when this pandemic first started, that, most of the folks that I was working with were actually doing pretty well. And that was sort of curious. And then I started talking to my colleagues who do clinical work, and they were noticing the same thing. We thought, this is really interesting, right? We thought we anticipated an increase in distress, but really everyone in general seems to be doing okay. And when I got more into this with some folks, they talked about, well, as a cancer survivor, I'm used to being socially isolated as I'm going through treatment. I'm used to being told that I'm very immunocompromised, and I have to be very careful where I go and be very aware of my environment. I'm used to uncontrollable stressors of not knowing how the treatment's going to impact me, of not knowing the future, my prognosis, and things like that. So a lot of the people that you work with already have skills that they can utilize right now to help them get through these difficult times, but they may not realize it, right? So kind of the biggest thing is like living with uncertainty, living with the unknown. Well, probably in most cases, they've done that before, and they have some of those skills. Also is a reminder that people who live with chronic health conditions or cancer survivors also have a lot of expertise in being able to monitor their own symptoms, usually knowing how to get a hold of the medical team, communicating with the medical team, which much of it may be through the work that all of you do, and also communicating with their family and friends around their medical condition. So I think it's important, there's a lot of anxiety in people, like the what ifs. What if I end up getting COVID? What if I end up getting sick? And again, there's a lot of resiliency to remind them of, like, you have a lot of experience in working with the medical system. So you can draw on that, or you don't need to worry so much about that. So I think it's important that we just remind our patients that we're working with that they do have a lot of resilience given their past experiences. So that's all I have for my presentation, but I would love to take any questions if you have any. And thank you very much.
Excellent. Thank you, Kristin. And just a quick reminder that if you do have questions, if you can please use the chat and bring those forward, that would be great. So Kristin, early on when we were talking a little bit about different programming opportunities for navigators and CHWs who are working in the field and thinking about the response to COVID-19, and really what was helpful for even people who were themselves part of the teams that were working with patients who might be impacted. We were talking about fun activities, or we were talking about things that could be distressful, or that could be basically de-stressors, mindfulness activities and the like. And one bit of advice that we received from a psychologist was, let's just wait and see what's helpful for people, because on some level, this isn't really quite anything that we've seen before, right? That we're thinking about the ways that we've engaged with people from different means of providing opportunities for, like thinking about anxiety and thinking about depression and thinking about, probably risk aversion and the complexities. And I know that you talked a little bit about that, and particularly as we're moving forward with folks. So I'm just curious, as you're talking, in terms of some of the approaches for working with patients or thinking about different things that have been brought forward, such as MI, mindfulness, perhaps my camera shutting me off again, sorry about that. These sort of types, cognitive behavioral therapy. I guess, is there anything in particular that you would say that ultimately this time in the pandemic, that it's different in terms of how we engage with folks than, another historic time, or ways that, like, from a chronic illness that people are dealing? Are you seeing a difference, I guess, in how you would approach, or different strategies that may or may not be helpful?
Yeah, well, I think one of the big things is, and I would take a different slant, I guess, from what was said earlier. I feel like, despite, we don't know how this is all going to end, but I do think there are some just basic general things that are really helpful for people. So, there's been a lot of anxiety, a lot of rumination, a lot of worry. I say to people, and I think I actually have this slide in the PDF that you guys will get. I cut a few out just for time, but I say, worry or anxiety, feeling fearful is pretty normal during this type of situation, right? That's protecting us. That's our brain saying, I'm feeling some fear, so that's going to keep me staying away from people or doing the things that I need to do to keep safe. It's when it falls into that rumination, getting stuck there. Sometimes I call it that worry wheel that just keeps going, going, going. That's when I really say, okay, now we need to recognize this is not helpful anymore. And in fact, this is doing you more harm, because not only is it bad for your emotional well-being, but it's going to have an impact on your physical well-being, because it's probably going to impact your sleep and maybe your health behaviors. You might drink more alcohol, you might use more marijuana, all these different kinds of things that then sort of amplify this cycle. So I think it's really important that people use, different kinds of strategies. So it could be tailored, depending on the person, but different kinds of distraction activities, things that just get them off that worry wheel. That's not helpful, because we know that when we're dealing with especially uncontrollable situations, trying to get stuck, worry is about the idea of, if I worry about it enough, I'm going to find a solution. But right now, a lot of the things that people are worrying about, we don't know yet what the solution is. So we're getting stuck. We're trying to problem solve something that is not solvable in the moment. So I really encourage people to, engage in activities and healthy distractions that get them away from that. I think is really important. And then I think, as we're moving through these sort of different phases, it's just going to be really tuning into how people are doing in terms of their mood, because I think a lot of people who've been homebound and just staying in, there's probably a lot of unrecognized depression and anxiety that we're not seeing right now that may become more apparent as that happens. And I think within the world of sort of the medical system, what I worry most about, for example, is adherence, people not coming in for their appointments. And, we're talking a lot about that in cancer, about people missing screenings, whether it's the primary prevention side or more cancer survivor side, of people just missing surveillance appointments, screening appointments, and things like that. So I think that's going to be something to think about as, I think we already do. When people tend to be non-adherent, oftentimes there may be a psychosocial factor or a number of factors that are creating these barriers to coming in, and being even more mindful of now what may be going on that's creating these barriers to getting them back in the clinic when they need to be seen face to face.
Definitely. And I think, Kristin, I think Nick, the different programs that we have on cancer prevention and control, the elective procedure ban, and then now that we're back up, and even talked to a clinic system near Pueblo today, talking about now all the issues that patients have to really address, such as COVID testing to come in, like all of the barriers that are not barriers, but all of the new requirements. And there is a lot more. And I think, to your point, that it's going to be difficult. And I think, Kristin, something that you mentioned as well is also the situation around kind of COVID related illness and a chronic illness that may be coming out, and for particularly people. So ultimately, how do we also think about engagement and watching from a kind of longitudinal sense of where do people who had COVID, like what happens around some of the respiratory, cardiac, some of the other pieces, and how are we really mindful, SCHWs, PNs, and the team about really, because to your point, from we don't know what we don't know, that's helping in terms of a management from a psychosocial, but to your point around the direct medical issues, those are some things to consider as well. And I guess much like Nick, and in terms of thinking about these programs, I guess for navigators who are working in the field, I know we've talked about mental health first aid training. I think we've talked about different sort of approaches. But I guess, Kristin, if you're someone who's on this call listening today, you've heard how Nick and the team has worked with intervention, the tools, what approach they took. And those are some really good tools. But what would you add to that if folks are really thinking of getting into this work, where's a good point of entry to think about beyond screening, I guess, that you're speaking of? Like what else, what other training or what approaches should folks consider out the gate?
Yeah, well, I think that, what Nick's group is doing is great. I think so I think like getting training, if you don't already have it, in motivational interviewing is fantastic. Behavioral activation, some really brief CBT could be very effective with people across different demographics, rural versus urban. And I think thinking about, as I talked about in my presentation, like these, and it doesn't necessarily need to be, around a pandemic, but these windows of opportunity that you have with people, I think thinking about like every time you're having some sort of interaction, you could be doing something, you could be moving them, in terms of their readiness to make a change, whether it's, again, more mental health area or behavioral health or different health behaviors. So, I think don't ever downplay that impact that you can have. We know that there's, studies that show that all it took was a physician asking someone about whatever specific health behavior their use of tobacco, just that was enough to get a whole huge percent of people to actually work on quitting, right? So I think that this, additional having, like for yourself and the work that you do, those additional tools in that toolbox to be able to pull out of recognizing, wow, this person sounds like they're maybe ready to make some changes in their alcohol consumption. And let me just pull out some of my MI stuff that I know. Or, wow, this person just feels like they're stuck right now and with their ruminating, or they're just so stuck in being able to move forward. Maybe there's some CBT techniques that I can pull out that could be helpful in this moment.
Right. So use what you have in your toolbox, but make sure you've done some work with these strategies, which I think we've heard, the MI, CBT, thinking about mindfulness, and a few of the others. I guess, Nick, now that you've had a chance to hear Kristin share perspective and answer some question, anything else that's coming up for you to share, or anything that you had questions about either?
No, it makes me feel good about our program, actually, to hear Kristin kind of echo a lot of the same themes and everything. And so, yeah, I just think, in fact, I was thinking the whole time, Kristin, we need to work together more. So.
I know. Well, I have to disclose I'm on the CCPD review committee, so I remember your project, and I was like, "This is really cool." I was very excited about it. So,
yeah. So as we're talking about our CCPD funding, we have full disclose. It all comes full circle today.
Yeah.
Exactly.
Well,
yeah, but I liked how you did emphasize the COVID stuff and how that is really impacting people's stress and anxiety and things. I think just anecdotally from our navigators, they are just experiencing that a lot more when they call people. They are willing to talk about their anxiety and their stresses and things. And, the health goals that they made, maybe to eat better, they said, I can't even do that right now. I might lose my job. And so then they talk about other things. Let's address that stress. And so, again, I think our navigators are really doing a good job of meeting people where they're at, like you said, the stage of change. And so, but yeah, absolutely. I think the COVID stuff is really, really interesting right now. Not interesting in a very bad way, but definitely just how mental health is fitting into our navigators' roles and various things.
Definitely. And I do want to, Shar had a note that said Mental Health First Aid is currently working on the online curriculum. I think I mentioned, but she said that she's thinking at the end of June or first part of July that it's going to become available. So thanks, Shar, for the comment. And as we have more information coming, we will provide that out, because I think there's a lot of interest. We do have we have a question right now that says, motivational interviewing is very crucial, but not something that can be learned overnight. For me, remember ORS helps a lot. And I think, Nick, you had mentioned this as well, that if you don't use it, you lose it. And if you haven't had some of those opportunities to really engage and practice with it, it can be hard. So I'll start with you, Kristin, I guess, for MI. And as people are starting, any tips and tricks, and then Nick would love to hear from your navigators and from you guys' experience about what's been helpful. And then I'll make a shameless plug for some of the work that we've done through the Alliance and PNTC, and Aaron can share.
And I'm sorry, I'm just going to mention real quick, that was from Michelle, our patient navigator up in Northeast Colorado. And I'll tell you, Michelle, when she first started, she had that writing reflex. She wanted to tell people what to do, how to fix it, but she has done excellent. So good job, Michelle. Keep up the good work.
And Michelle, I'm going to give you a shout out. Even though I've been through MI, I just still tell people what to do. So there's some of us who just can't do it. I am that person, but I love all of you who can. Kristin, anything to say about MI? And then Nick will have some additional perspective.
Yeah, so I would say one thing that's important to remember about MI, and I agree, like if you don't use it a lot, it's hard. But I think it would always help me is to think about, so Bill Miller, who came up with MI, he never really meant it to be this big thing that everyone would do. And it was more for him, and if you've ever seen tapes of him doing MI, you'll understand what I mean. It was more his way of being, with patients, right? So it wasn't like he was developing this new intervention to be used with patients to help them make these big behavioral changes. It was just the way of being that he was with patients. So sometimes we get so caught up in the skills and all the different, there's so many acronyms in MI. I mean, I really even get overwhelmed by it all. But when I think of like Bill Miller and just like, what are the basic things? What are we really trying to do, right? We're really trying to figure out where is that person right now in terms of their readiness to change, and how can we move them a little bit by connecting them to their values? What are the things that are really important? And sometimes just having that conversation without having to do all the different ratings and where they are on the scale and all the ORs and things like that. Even that short conversation can be really significant and impactful.
That's great. Well, and Kristin, I will say the one thing is I always end, which is part of it, is an open-ended question, can even go a lot further. So even basics, I love that too. Nick, what else do you have to share? And then Erin, would love to hear about some of the offerings around the resources we talked about. But Nick, what's coming up for you?
Yeah, so Dr. Hubley, we've had Anjali, I forgot her last name, but she used to do AMI training for us. She was excellent, excellent, excellent. One thing that Dr. Sam Hubley, who did our most recent motivational interviewing training, is he did focus on the ORs, but what he focused on the most was the last two, the reflective listening and the summary. And so I think that was really important to instill, what motivation or ambivalence is in that individual by, echoing back what they said and then, summarizing exactly what they said. And oftentimes when you did that, it just, people would go further. People would start to talk, more and more about what they just talked about. So I think those two things are, for me, really, really stood out.
Great. That's awesome.
I just add to that. I agree. And I also would emphasize that those are really important skills just for patient-centered communication. So if you can do, even just reflective listening, that in itself is so powerful. So yeah, just wanted to put that plug in.
That's awesome. I actually had an MI course right before Thanksgiving, and it was an especially tense Thanksgiving with my family. And I found that MI was very helpful in interacting with them on some level too. So with patients or family members, it really does come in handy on some, because I really do think that the overall communication, it really does enhance overall, even the basic tips like this is great to talk about. I do want to say, and then I'll have Erin share a little bit about some of the resources that PNTC shared. The Alliance was able to provide some courses specifically around advanced motivational interviewing and cancer screening and cancer work. So on our Alliance website, and then working with PNTC right now, we do have some of those modules that are saved and that are open based on some funding that we received from the Colorado Cancer Coalition. But in terms of, I think really the focus we're talking about today is even the fundamentals and basics. PNTC does a beautiful job of providing that. Erin, do you want to share a little bit about PNTC's resources?
Sure. We offer both a basic motivational interviewing and an advanced MI course. And currently we are expanding those options to be online. So that's super exciting. And we don't have any scheduled yet, but we will for fall. So my kiddo is thinking, is wanting to say hi. She likes to see herself on camera. All right. And sorry, everyone. And I will also, when I send a follow-up email, I will link to the resources Andy mentioned, which you can watch now. They're all recorded webinars, and that way, you can get a start on improving your MI skills. So I'll include those resources.
Awesome.
And Andy, real quick from Shar Patton, they said, mental health first aid is currently working on an online curriculum. They think they're shooting for the end of June or first part of July.
Yeah, good deal. Got it. Okay. And I know that Lucille Johnson and Sarah were going to send along some information about possible opportunities for scholarships moving ahead for that work too, and we'll try to provide that. So I think with that, we are good for the afternoon. I just want to say a ton of thanks to Nick and Kristin, I think for those who might have joined from the beginning till now, it's just been amazing to watch the themes and the resources and the discussions evolve and really center into the direct work with all of you. So this was great. I think I've learned something at every session, and it's great to see the good success and things moving ahead. In relation to information about CCPD, we will forward that along, and then ultimately sharing more information about opportunities with the COVID-19 response, and I think the work throughout the state that may be developing to try to share that over the next couple of weeks. We really want to make sure that our community health worker and navigator teams are engaged in what's being developed and rolled out, as well as a number of our community and safety net partners. So more to come on that as it's developing. We want to try to get the word out real time as well. So Nick, Kristin, anything else before we close today? And I know Erin has eval.
Thanks for having me.
Yes, please fill out the evaluation when it pops up after you exit the webinar. We really appreciate your feedback, and it should just take less than a minute.
Okay, good. And we got a note that Erin, your kiddo is adorable. You might not have known this, but she was jumping behind you and we loved it. And that my hair looks great. Thank you, Julie. I really appreciate that because I'm having some real bad hair days. So, and a huge thanks to all of our, the folks who've been engaged in this work. So Erin, you got the eval, we're good?
Yep, we hope to see you next week for our final session in the series.
All right, everybody. Thank you so much. Have a great afternoon.
Bye. Thank you.
Bye-bye.
Thank you.